Joining us here on PM Express again on the day when the much anticipated voter registration exercise got underway across the country. It has been mixed. Some places it has gone smoothly. People respecting and adhering to the COVID-19 protocols that have been put in place. This is historical. First time we are registering voters in the midst of a pandemic. And so it's not business as usual. But what has complicated it further is the controversy that had, come before the registration itself among the many political parties. And today it got off. We haven't heard yet of any violence breaking out. At least many were concerned that that will be the story as the registration began in many parts of the country. So today, we're going to assess how day one has gone and what day one means for the remainder of the time that Ghanaians will be queuing in their numbers across the country to register. And I'm delighted to say that I have just the people to help us go through this and also do some public education as well, because it's clear that you cannot inform people enough about this because it's such an important civic responsibility. And that is why I'm delighted that we could speak to Sylvia Ano, who is the head of public affairs at the Electoral Commission, who is joining us via Zoom tonight. Also joining me is Dr. Kwesi Jonah. He's a senior research fellow with IDEC, that is the Institute for Democratic Governance. Also with us is Albert Kofi Ahin. He's the national coordinator of the Coalition of Domestic Election Observers. He himself used to be a senior fellow at the Electoral Commission, so he knows a fair bit about registration exercises. And of course, I told you, this is historical because it's the first time we are having a registration exercise in the midst of a pandemic, and we cannot have this conversation without a public health expert. And Dr. John Amoisi is the leader of the Global Health and Infectious Disease Research Group at the KCCR and the Lecturer School of Public Health Care in UST. Always a delight to hear from him, and he also joins us as we plow through how today had been. So join me as we have a very exciting conversation right ahead for you. I want to start with you, Sylvia. Sylvia, what are your reports telling you from the Electoral Commission's point of view? How has day one been?
Can you hear me?
Sylvia, I think we could hear you. I don't know if you've muted your Zoom connection to us, but if you have, kindly unmute it because we didn't hear anything you said.
Thank you very much. Can you hear me now?
I can hear loud and clear. Thank you, Sylvia. Yes, you were giving us assessment of how the one had been from the EC's point of view.
Yeah, let me say that it's been quite successful, across the length and breadth of the country. Reports that we have had so far during the day indicates that there was high turnout at some of the centers, to the extent that some registered as many as 155, some 127, some 100, and so on and so forth. Averagely, we're expecting that about 100 people will register during the day. We've had very few instances of the printers not working properly, and as soon as our technicians stepped in, they started working. We've had a few issues, very few issues of some of the applicants not social distancing as they should, and I believe that this is something that we have to work on going forward to make sure that we are there, all of us are there to the safety protocols spelled out by the Ghana Health Service. It is important at this point in time. So far, so good for the first day.
Okay. So far, so good. Let me bring in Mr. Albert Ahin from Kodeo. They've been, Mr. Ahin, you have your men on the ground, I assume, monitoring the exercise. What are your initial reports telling you?
Good evening to your listeners. We told you initially that we sent in about 100 observers. Out of the 100 observers, at the time that I was leaving the office around 4:30, we had reports from about 40 of them. And, Kodeo normally has some initial observations that we report on. For example, we would want to know the setup of the exercise, the registration exercise, the setup. And then we would also want to know whether all the materials, for example, are there in sufficient quantities. We would want to know the rules and regulations, whether they are being strictly obeyed by the EC itself, and whether the people they have trained and employed are doing the right thing. So from the reports that we had from these 40 observers, they are all saying that it was a very smooth exercise, so it took off very smoothly, except that a few centers had the assistants arriving late, some arriving at about 8 o'clock, some 8:30, and so forth and so on. But I believe this must have been due to the start of this, as I'm sure as time goes on, it will pick up and everything will be fine. We also had to look at the security situation. And in all the centers that the security was okay. Uniformed policemen were all around. And then as regards the availability of registration materials and the other materials, they were all there. The only problem that they reported, and which is of concern to Kodeo, is that in most of the centers, the COVID protocols were flouted. And in fact, there's even a report from Nantong in the northern region that mere washing of hands was ignored. They were not washing hands at all. And I myself happened to be at one of the centers this morning, and I was shocked to find, everybody was just sitting close to each other. They were tight. And I was wondering whether we knew what we were doing because we were in the COVID era. So the registration officer was telling me that they have tried very much to convince people to respect the protocols, but nobody was yielding. The policemen confirmed this. So maybe that is an arduous task. The EC has to take a look at this very protocol thing and then try to see what they can do from tomorrow. Because it looks as if Ghanaians are not worried about the COVID. They are just doing their own thing. They are not worried. I visited a center where I saw people seated beautifully, and that was the only one that was okay. But from all the reports that we received from the 16 regions from our people, it appears the COVID protocol is a major problem. So this is the initial thing. It was a smooth takeoff. The devices worked well because I don't think anybody reported to me that a device was off. The only thing that also came up, which was worrying, was that some people didn't know that they were not in phase one. It means they were not abreast with the movement plans that the EC had put in place. I saw them in the papers, but I believe maybe with time, the EC can do some public education on this particular issue. There are some people who didn't know. I understand in one village in the Volta region, they all trooped to come to the place, only to be told that that was not their turn, so they should go back. So I believe Sylvia is listening. The public education has to be intensified. People will have to know. Of course, in the papers, those of us who can read can always take a look at it. But I believe with time, the FM stations, the various localities can be reading out some of these electoral areas and their polling stations, and the time people should actually go there to do the registration. So far, this is what Kodeo has observed. I'm sure from subsequent days, we'll be able to add more.
Yeah, I mean, and very good points there. I'll get Sylvia the last 15 minutes to do some education on the approach they are adopting so people get informed about this. I want to bring in Mr. Kwesi Jonah into the conversation. Mr. Jonah, you and I had the doom and gloom that was predicted by the political interested parties ahead of the registration. People were arrested, words like they will kill each other. Ghana will burn. We had all these demonstrations, threats of mayhem. It appears to me that we have averted all that, and that there's no sign that any of that we all feared will ever come to pass. The Ghanaians, largely once the process started today, were all embracing of registering to vote on December 7th. Okay, we've lost Mr. Jonah there. We'll try and get him back to give us his thoughts on this. But I want to go to Ms. Amoisi now, who's the public health expert on this. Ms. Amoisi, we had Kodeo, Mr. Ahin, make the point that the observations show that many centers across the country, the COVID-19 protocols that were put in place were not respected. People disregarded it blatantly. That must break your heart, knowing the implications of that.
Good evening to you, Evans, and to listen to all over the country and beyond. So that in case as I've always mentioned, when people gather, there is always a risk of spread of disease, and the desire would be that in an exercise like this, as far as possible, contact among people will be limited, the amount of time that they spend will be limited, and the amount of interaction, especially verbal interaction, will also be limited. The evidence from research is showing that this disease is primarily spread from person to person. We used to believe that infected surfaces and others were also a major way in which the infection spreads, but the evidence more recently that we're gathering suggests that yes, there is a possibility of spread from contaminated surfaces, but most importantly, spread is from person to person, which is when people are in contact with each other, especially when people talk, when they shout, when they sing, or sort of express themselves vocally. This is when the virus is able to spread. So in an environment like a registration where people would be sitting together and would be interacting verbally, it certainly poses a risk. And I did state the other time that I believe no one would disagree that there is some risk involved. What we need to focus on would be the approaches that we need to take to reduce the risk of spread. One major thing I'm not hearing much about is the amount of time which individuals would spend at the registration and the amount of interaction, especially verbal, vocal interaction that would take place at that place. The amount of time that you spend significantly influences risk of transmission in case someone is in contact with an infected person. So the longer the time, the increase in the risk. There's also a third variable in there, which is the amount of vocal or verbal interaction. And one of the things I would strongly encourage is that people should limit the amount of talking and verbal interaction that goes on in these places. And perhaps that's the one thing that we need to highlight. Less talking. If you can, just don't talk there, because the more you talk, the more you project the droplets out of your mouth. Of course, you should be wearing a nose mask, a face mask, which should reduce the risk of these droplets further projecting, but you can do a greater service by even limiting the amount of talking. Now, it sounds very impractical in an environment like that to tell people to reduce talking, but I've seen the way in which when human beings, when we understand why we're doing something in a certain way, we can hold each other accountable. And I believe that if this message about reducing the amount of time and reducing the amount of vocal, verbal communication, when that message goes out very clearly, we can make some significant headway and hopefully reduce significantly the risk of transmission. So these messages need to be pushed constantly. Another important point that we need to talk about is the amount of ventilation in the area. And I'm happy to see that a lot of the registration, the queuing is taking place outside and not in a closed environment, not in air-conditioned rooms and the like as much as possible. We want this to be outside to reduce the risk of transmission by virtue of being in a confined space and having limited ventilation. So this is also a very important thing that needs. I'm sure I'll come back to you with a few other points related to this exercise, but maybe the one thing that I need to press on again is just limit the amount of talking.
And thank you for staying with us here on PM Express. Apologies for that, a slight technical hitch, my inability to hear my guest talking, and so we had to take a quick break to rectify that. I can hear very clearly now. Dr. Moisi, I'm guessing that you had said a lot about your concerns with the process, as we had heard from Codeo there, based on the observations. Listen, this is the challenge with COVID-19. We're all getting used to the staying home and working remotely with technology sometimes failing you. But having anticipated what you had said, if you don't mind, I want to hear from Mr. Kwesi Jonah, who I understand has also reconnected. Now, we lost him earlier, just as I also lost you earlier. Mr. Jonah, I was talking earlier about the doom and gloom that was predicted ahead of the registration, and how day one had proven that a lot of those doom mongers have been proven wrong. Am I too excited too early, or this day one shows that it was much ado about nothing?
I think you are absolutely correct in your assessment. It's a very positive aspect of Ghanaian political culture. Once a court has decided, people tend to abide by the court ruling. So you see that all those people who threatened that when the registration starts, let us go there with our old cards and disrupt the street and so on and so forth, nothing happened. I believe in this aspect of Ghanaian political culture, that once a court has made a decision, people may back and so on and so forth, but in the end, they will comply. That is why no disruption whatsoever happened. But I just want to also express some of the more positive aspects of the first day. If you look at the turnout, it was so very high. And it's not just the turnout, but the time people turned up at the registration centers. Some people were there 4:30 a.m., 5 a.m. in the queue, all of them trying to register as early as possible. And then, of course, the other important aspect of it was the presence of party agents as well as observers. I know Codeo, for example, is there. They've deployed about 100 observers. We also intended to do the same, but last minute we had to change the decision. And then it also shows that even as all these court suits were going on, and in the light of lockdowns and imposition of restrictions and so on and so forth, the EC was actually preparing. And that is why the first day has turned out to be so successful. But believe me, the Ghanaian is so very law-abiding and believes in the rule of law that once a court has taken the decision, they will by and large try and comply with it. That's why everything has gone so very smoothly.
Yeah, I mean, so of course, this is good. But Mr. Jonah, the fact that day one has been this peaceful, I mean, does it suggest that this is what will be the norm for the next 1 month?
No. Every registration, whether there was COVID or no COVID, whether there was an imposition of restrictions act or no imposition of restrictions act, whether there were court challenges or not, isolated incidents of violence sometimes happen. It happens normally when people suspect, for example, that a particular party or candidate is busing people across constituency boundaries. And, people, so going forward, I expect some minor incidents to happen. Right now, I think in Honorable Collins Dada's constituency, is it Asunafu South, something happened. An MPP constituency organizer was brutally assaulted, who is right now in a hospital, by people riding motorbikes and so on and so forth. Isolated incidents of this nature we may expect, but real violence on a large scale, I don't think we are going to record any of them.
Good. Let me bring in Sylvia. Sylvia, I want you to address for me the concern that we heard earlier from Kodeo's monitoring, which is again confirmed by our monitoring here at Multimedia, our reporters across the country. The blatant disregard for the COVID-19 protocols that the EC itself put in place. People were not wearing face masks. Social distancing was completely ignored in places. People were not washing their hands in places. That is so dangerous. What happened there?
Yeah, let me come in here. Mr. Ayin mentioned that Kodeo had sent 40 observers to the field. Now, we're dealing with 3,500 registration centers. Now, going to 40 registration centers, I believe that they needed to have gone to more registration centers to be able to make some kind of generalization, because we are dealing with 3,000 for the first phase. We are dealing with 3,500 registration centers. That is not to say that we didn't have experienced that kind of thing at some registration centers. And going forward, I have explained that we are going to intensify publicity, and also we are liaising with the security services to ensure that they enforce the law, making sure that there is social distancing, at all the registration centers. Now, I don't know how many registration centers you visited. I'm referring to Multimedia. But going forward, I think it is a collective responsibility, apart from the enforcement. We all have to make sure that we are properly masked before we go to the registration center to register, and so on and so forth. And we are supposed to have markings on the floor so that we properly social distance. One person is at a point, and then the other, there's a gap. So you don't necessarily have to get closer to them. So for us, at most of the registration centers, it went very well. But going forward, like I earlier said, we're going to make sure that we are liaising with the police to enforce and make sure that people adhere to the safety protocols spelled out by the Ghana Health Service. And let me also assure you that the officials have been trained well to handle the issues. We have the health officials at the registration centers to check the temperatures and so on and so forth. So we have put in place all the safety measures. We just want to appeal to the general public to also conduct themselves properly when they come to the registration centers to register.
I mean, primarily, the EC has the ultimate responsibility in ensuring the adherence to the COVID-19 protocols. I want to read to you something that the Ghana Medical Association said today in a statement that they issued. And they say that the EC chairperson and other members of the commission, the EC security agencies and the various political parties, the EC chairperson and other members of the commission should be ultimately held responsible and accountable by the state for any wanton disregard for or non-enforcement of COVID-19 preventive measures at any voter registration center that has the potential to spread the disease. Does the EC accept this position as expressed by the Ghana Medical Association, especially look at what we've seen today?
I have indicated to you that in my earlier presentation, that the Electoral Commission has put in place measures to make sure that the safety protocols are adhered to. Now, we have 3,500 registration centers across the length and breadth of the country. Now, going to 40 registration centers and using that to make some kind of generalization, I think that it's unfair on the part of the Electoral Commission.
But that position, Sylvia, is confirmed by, we also have reporters across the country, in all regions, 16 regions, and in many polling centers across the country. That was also confirmed by our own reporters, together with what Kodeo has said.
That is not to say that the safety protocols were not adhered to at all the 3,500 registration centers. And I can assure you that going forward, we are liaising with the security services to make sure that there is some kind of enforcement. So before you get to the registration center, you must be masked properly. You must wear your face mask properly, adhere to the safety protocol. You have monitors on the ground who are also checking to make sure that we are there to them. These are teething problems, and I can assure you that the Electoral Commission will have all of them rectified. And then again, he talked about the fact that there was some kind of high turnout at most places. It confirms the fact that we intensified our publicity, and these are the indicators. But all the same, we observed that some applicants moved from their areas of residence to other areas. They crossed over, probably because they thought they wouldn't have the opportunity to register. But let me take this opportunity to assure all Ghanaians, all prospective applicants, that the teams will move to every registration center. Your time will come if you are an applicant. If you are a prospective applicant, your time will come. So there's no need for any kind of panic, registration, so that you move from your area to another area. You may be challenged, and you may even be denied your right to register. So I think that going forward, we will intensify our education. These are teething problems. There is no perfect registration anywhere in the world. And I think that today has been fantastic. We're going to do some kind of SWOT analysis and get back again from tomorrow, making sure that all the safety protocols are adhered to a very large extent, as well as the other measures that we're going to put in place to make sure that the exercise is successful.
I mean, this concern about people moving from their other places into other constituencies had come up quite strongly in Ashanti Regional Constituency, where Muntaka Mubarak is the MP there, and he's raised concerns about it. We'll talk about that. I guess that is one of those issues that education could deal with, because this particular registration is being handled differently in terms of the rotation of the registration centers. But I want to bring in Mr. Ahing. Mr. Ahing, talking about your observations. I mean,
I was going to say that before you bring in the next speaker, let me also say that our mobile vans are going round. We have done extensive publicity as far as the locations, the movements of the team are concerned. And apart from that, for each registration center, we have the itinerary of the center, of the team pasted at the registration center. So you, as an applicant, a prospective applicant, you can go there and check when the team will arrive at your end. So to avoid the panic registration, because you can be challenged, if you so move to cross to another area to register as a voter, you may on that basis be denied.
Quickly, I think we may have a challenge with the line, but I'll quickly bring in Mr. Ahing. Mr. Ahing, on that question of the people moving from one area to the next and causing some tension, we've seen in Asawase, for example, Muntaka Mubarak's constituency in the Ashanti region, he's complaining about infiltration, warning that they're going to resist that. Why do you think that is? Is it a communication gap that people don't understand that process? Sylvia, I'm going to come to you to explain more about, so people can understand this. But how can this be rectified, Mr. Ahing? Is this something that you've also picked up as a concern, maybe?
Yes, it is a concern, and I believe it is a communication gap. And that was why initially I was talking about the fact that we should intensify the voter education and tell people when it will be their turn to come to the various centers to register. We need to really hammer on that. And when we have done enough of that information going around, I'm sure people will stay put. We should assure people that no matter what, their turn will come so that they also go to register. But that will mean that we need to let them know beforehand that it is going to be on a weekly basis. When one phase is finished, the other also comes in. So it will be a matter of, even in the rural areas, the EC can resort to beating of gong gong to inform the public that in this particular village, this is the day, this is the time that you should be going to do this kind of exercise. In the towns, in the urban areas, it's not too serious because the people there have access to papers that they can read. But in the rural areas, it becomes a problem. So there will be the need, for example, to get the chiefs informed so that they can also tell the people, and they stay put so that come their time to do it, then they come, instead of moving and being anxious of the fact that maybe they are being ignored.
I mean, Mr. Jonah, there's also the concern when anytime you do registration exercises about having a higher turnout to make the register itself legitimate. Many had expressed concern that because of the peculiarity surrounding this registration exercise, COVID-19, the threats of mayhem, etc., that people will not turn out in their numbers to register. Clearly, from what we've heard from the EC so far, and I guess a bit of Kodai and what we've seen on the ground, there's a lot of enthusiasm amongst Ghanaians to register, in spite of the concerns that COVID-19 brings and the threat. That certainly can be a good thing. It's an indicator of where we are as a country in terms of people's alertness to their civic responsibility.
That is definitely true, Evans. People are very much alert to their civic responsibilities. But to a very large extent, we should also commend the leadership of the various political parties. You heard His Excellency John Dramani Mahama asking his people to go out in their numbers to register and vote. And the people will listen. His Excellency President Nana Addo Dankwa Akufo-Addo, when he gave his nationwide address on the eve of the registration exercise, he appealed to the people to go out in their numbers to go and register. So you see very clearly that the leaderships of all the political parties really want their members, want the people of Ghana to go and register, and that is exactly what they are doing. But Evans, I want to, I have identified a certain confusion in your earlier question, which I now want to clarify. You asked a question about people crossing constituency boundaries. That is very different from the issue that my sister Silva Ano was talking about. When people pass party members or supporters across constituency boundaries, it is different from what Sylvia is talking about. What Sylvia is talking about is there are 5 clusters, 5 police stations in a cluster, and every police station in this cluster will be attended to. Somehow, people have misunderstood that they may not come to my police station. So I want to rush very early to go and register. That is a different matter. So subsequently, when the team moves to other stations, there may not even be enough people to register because many of them would have gone to the first and the second station to register. That is a completely different problem. This one is due to lack of communication. But the other one, busing people across constituency boundaries to register, is a completely different problem. What happens is that if a party feels that in a nearby constituency, I have too many votes, I can definitely win the seat. I don't need all the numbers. But in the next constituency, I have nearly not enough voters to be able to capture that seat. In this case, Asawase. So they move some of the surplus voters across constituency boundaries. It's not from one police station to the other. So what Honorable Muntaka is complaining about is moving people from nearby constituencies to Asawase constituency to register in order to increase the NPP's power. What serious allegation he has made is that the EC is conniving by locating the registration centers across the borders of the constituencies so that people can very easily sneak from one constituency. These are the first one, it has always been there, busing people across constituencies to go and inflate the votes in for another candidate, another constituency. But everybody, but people don't understand it that way.
Yeah, I mean, that clearly it's right there. It's a recipe for chaos. I'm going to take a quick break. When I return, I'll get Sylvia to address that particular one, what the EC attempts to do about that, but also pick the brain of Albert Ahing, his experience from previous registration exercises, how the problem could be dealt with. And I'll hear from Ms. Amoisi on the question of ensuring adherence to the COVID-19 protocols going forward. I'll get his thoughts on the GMA's position that the EC chairperson and the other officials there must be held responsible once we see disregard for the protocols. Stay with me. Thank you very much for staying with us here on PM Express, and thank you for welcoming me into your home from my home. I still having a conversation with my guest, Mr. Kwesi with the IDEG, Albert Ahing, the CODEO, Sylvia Nor, the Acting Public Affairs Director with the Electoral Commission, and Mr. John Amoisi, Dr. John Amoisi, Public Health Expert there. Dr. Amoisi, to you next. You earlier on talked about the COVID-19 protocols. We've heard a lot of, what has happened today. We've heard what the EC says they will do. They're going to get the police to strictly enforce this going forward. I wonder the position that the Ghana Medical Association expressed today in a statement that it released, warning that this could have dire consequences if the protocols are not followed, insisting that the EC chairperson and other members of the commission should be ultimately held responsible and accountable by the state for any wanton disregard for non-enforcement of the COVID-19 preventive measures. What do you make of that position? As against what others might suggest, that really, in terms of the COVID-19 protocols, it is a matter of law. There is an executive instrument that spells out punishment for not wearing face mask and not social distancing. And that the primary responsibility is that of the police to enforce during this period of the registration, not necessarily that of the Electoral Commission. Where do you stand on that?
Brings to light the complex nature of this activity. I'd just like to reiterate the points that I've been making over a couple of sessions, which is the fact that once people gather and scatter, you significantly increase your risk of spreading infectious disease, in this case, COVID-19. The longer the time people spend together, they increase in the risk of transmission. And for this reason, there are different levels of responsibility which need to be exercised in order to reduce as much as we possibly can the risk of transmission. First level is the individual responsibility, which has now been adequately catered for within our legal framework, where in a public place, it is mandatory that you must be wearing a face or nose mask. I think this was a landmark legally backed intervention, which will significantly reduce risk of transmission. And once it becomes a legal responsibility, then of course the police becomes responsible for ensuring that this happens. Because if I am wearing a nose mask and someone isn't, it significantly increases my risk, and vice versa if the tables change. When two are wearing a nose mask, it exponentially increases the level of protection, or in the inverse, exponentially reduces the risk of transmission should there be any infected person. And I also alluded to the fact that speaking or vocal verbal interaction also is a very important thing that we need to emphasize. And I want to use this platform to emphasize again that we need to teach people to limit the talking as much as they can. I'm just looking at your video right now. I can see high levels of verbal interaction going on at the registration center. Is this something you want to discourage? People should be in masks, should be socially distanced, and also should avoid as much as possible even talking to each other. I think the talking to each other part has not been emphasized enough. The second level of responsibility would be the level of responsibility of whoever is convening the gathering of individuals, and in this case, the Electoral Commission. The Ghana Medical Association, as an association, has a vested interest in protecting the health of Ghanaians, not only the health of Ghanaians, but very importantly also the health of health personnel. In this case, medical doctors who be at the front line of seeing people who are ill in the hospital, nurses, pharmacists, laboratory technologists, and others who see patients. And you can already see the numbers of health personnel who have become infected with COVID-19 clearly linked to the line of their duty. And if the numbers of patients or cases should go up, it means that the risk to health personnel would increase substantially. So aside being concerned about the health of Ghanaians, the Ghana Medical Association would be concerned about the health of their members, of which I am one. And so I don't think it is out of place for an association to call for some level of responsibility to be placed on whoever is convening this gathering. We have currently a legal framework that allows responsibility to be placed on individuals or can hold individuals accountable. But we need this additional level of responsibility placed on the convener. If you have these two levels of responsibility interacting adequately, you will substantially increase the probability of protection. And so I think that this call by the Ghana Medical Association is in the right direction with regard to protection of Ghanaians and ultimately the protection of healthcare workers. Can you imagine a scenario where you have a large number of healthcare workers affected? This would invariably mean that you can take less care of people who are sick. It would mean that people who are sick would need to stay at home or be within the community. It would perpetuate the spread, and then you spiral out of control. So this call really has a lot loaded behind it, which needs to be unpacked, as I've tried to do, to really appreciate the angle from which it is coming.
Yeah, I mean, and very quickly, if you may, what is your verdict so far, having observed day one, in terms of the COVID-19 protocols that were rolled out and the observance and adherence to these? What's your verdict? Are you happy with the way day one had gone in terms of the COVID-19 protocols and the observance?
Well, Evans, as a medical practitioner, more importantly as a researcher, I must say very clearly that I'm not in a position to offer an empirical assessment of level of compliance. We'd have to really do this in a very systematic way. But if I should simply judge by what I saw on the screen as you're rolling the clips and what I read about and saw pictures of, it is clear that protocols were adhered to in some places, and in some places they were not adhered to. The distribution of level of adherence, I'm certainly in no position to measure this, and I don't think that there was really anyone who was systematically collecting data on level of adherence to the protocol. So long as we can clearly identify that in some places this was not adhered to, we would like to speak about it. And again, from the public health angle, we always say that when public health is working well, you would hear nothing. You only hear public health concerns or issues when things are not working well. So it always looks like public health people are focusing on the negative, but that's exactly the way public health works. If it's working fine, you hear nothing. So in this case, I would like to speak about the little I saw And Sylvia has already mentioned that she referred to these as teething problems, but I hope these teething problems will be solved pretty quickly because the implications, if these are not addressed quickly enough, would be dire with regard to the risk of spread. And I think if we're able to tackle these quickly and make sure they are enforced, both at the level of personal responsibility, wearing of the mask, and then the level of responsibility of the EC, which is forcing people to follow the social distancing rules, and also to reduce the level of verbal interaction when they're sitting down or standing and waiting in line to register, I think would go a long way to reduce the risk of transmission.
And Sylvia, day one, anything the EC intends to improve upon going into having learned from today and going into the rest of the days, very quickly in the next 30 seconds, what do you hope to improve at the Electoral Commission's level? Before I move to that, I just want to remind all Ghanaians that we are mandated by law to, because of the registration exercise, we are mandated by law to conduct this kind of registration exercise. So we want to appeal, to all Ghanaians to observe the safety protocols, abide by the tenets of the registration exercise throughout the country to make sure that we have a successful exercise at the end of the day. Silva, thank you very much. That's it for PMS for tonight. Thank you, gentlemen and lady. Go out there and get registered. It's your civic responsibility and duty. My name is Evan Smith, and thank you for welcoming me into your homes. Enjoy the rest of your evening.